accessible tone. Hello and welcome. Thank you for joining this presentation on Chelation Infusion therapy, a medically guided treatment aimed at removing harmful heavy metals and toxins from the body. This therapy is gaining attention not only for detoxification but also for disease prevention, recovery support, and anti-aging purposes. Today, they'll guide you through what it is, how it works, what the treatment involves, and who it can benefit. Let's begin. The word chelatin comes from the Greek word for claw. That's because chelating agents act like cloths to bind tightly to heavy metals inside the body. In this therapy, the chelating agent is administered through an intravenous strip. Once in the bloodstream, it latches onto harmful substances such as mercury, lead, cadmium, and arsenic. These are then safely carried to the kidneys and excreted in the urine. You can think of this process as a sort of deep internal cleaning, helping the body get rid of toxic elements that natural detox functions often can't manage on their own. So, why do we need this kind of treatment in the first place? In modern life, we are constantly exposed to heavy metals from air pollution, pesticides, processed foods, drinking water, cosmetics, and even cookware. These metals build up slowly in our tissues, particularly in the brain, bones, liver, and fat. Even small amounts, over time, can have harmful effects. Symptoms may include fatigue, brain fog, sleep disturbances, headaches, weight gain, and chronic inflammation. More seriously, long-term accumulation of metals is linked to arteriosclerosis, heart disease, memory loss, and neurodegenerative conditions such as Alzheimer's and Parkinson's disease. This is where chelatin infusion therapy comes in. It offers a controlled way to reduce the toxic load. The main medication used is called calcium disodium EDTA, or COD-EDTA. It's especially effective at binding to lead, aluminum, and cadmium. For mercury, another agent called thiola may be added. Often, the chelating solution is mixed with vitamins and minerals to support the body during detox. The treatment is personalized depending on your health history and test results. Before starting the therapy, your physician will recommend specific lab tests. These may include urine heavy metal tests or oligoscon, which detect the level and types of metals present in your body. Standard blood work is also needed to check kidney and liver function, since these organs played a key role in eliminating toxins. These tests help ensure that the treatment is both safe and effective for your specific needs. Each infusion session typically lasts 60 to 90 minutes and is done in a relaxed, outpatient setting. Most patients come once or twice a week. Every 5 sessions, a blood test is performed to monitor kidney function. Every 10 sessions, your mineral balance and heavy metal levels are rate evaluated. Treatment continues until your levels return to a safe range. Afterward, follow-up testing is done every 6 to 12 months to monitor for any recapitulation. Proper aftercare is essential. Within 3 hours after each session, drink at least 1.5 liters of water to help flush out the toxins. Avoid activities that cause intense sweating, such as saunas, hot baths, or strenuous workouts on the same day. It's also best to avoid alcohol after the infusion. You might notice slightly increased urination or yellow-colored urinothesis as a normal part of the detox process. One important consideration is zinc supplementation. While the chelating agent removes toxic metals, it can also bind to beneficial minerals like zinc. To prevent deficiencies, a zinc supplement should be taken for hours after each treatment. Possible side effects include minor bruising at the injection site, a drop in energy, or slight nausea, especially during the first few sessions. To avoid low blood sugar, it's a good idea to eat a light meal or snack before treatment. Gelatin therapy is not for everyone. It is not recommended for those with moderate to severe kidney dysfunction, congestive heart failure, serious liver disease, pregnancy, or acute lead encephalopathy. For this reason, pre-treatment screening is very important to determine whether you are a suitable candidate. The number of sessions depends on the reason for therapy. For anti-aging purposes, a course of 10 sessions, spaced every 1 to 2 weeks, is typical followed by maintenance once every 3 to 6 months. For those looking to prevent cardiovascular issues, 10 sessions may also be sufficient. If you already have symptoms of arteriosclerosis, treatment may require 20 to 30 sessions. In cases of heavy metal detoxification, 20 sessions is a common protocol. All of this is customized to your condition and monitored closely. Now, while gelatin therapy is powerful, its benefits are significantly increased when paired with a healthy lifestyle. This includes quality sleep, a balanced diet, keeping the body warm, moderate exercise, and even something as simple as laughter. Yes, studies show that laughter stimulates natural killer cells and supports immune function. At UE Clinic, great care is also taken in food preparation using natural, additive-free ingredients, no gluten or dairy, no fried or processed foods, and meals rich in enzymes and raw nutrients. In summary, gelatin infusion therapy is more than a medical procedure as part of a holistic strategy for restoring health, reducing risk, and aging gracefully. If you're interested in learning more or customizing a treatment plan, I'd invite you to explore Jotnaline. I'd a resource for advanced therapies, medical translation, and wellness education. Thank you very much for your time and attention.